Good morning. Thank you for joining us on Facebook Live. I am Nicole Moccasin, the community health worker for the Lincoln area. Today we have joining us is Rebecca Lechner. And Rebecca is our nurse practitioner here at our new Ponca Health Services in Lincoln, Nebraska. So Rebecca, could you tell us a little bit about yourself?
Yeah, so I'm a family nurse practitioner here in Lincoln at the new facility here. And I have been here for a little over 6 months now. And I graduated last year with my doctorate in nursing practice from Methodist College. I am originally from Northeast Nebraska, where my parents currently reside. And my grandpa is actually from Niobrara. We are actual Ponca members as well. So it's kind of nice. The Ponca tribe supported me through high school and college to get my advanced degree. So it's kind of nice to be back working for the tribe and giving back to the community.
Oh, nice. Yeah. So today we're going to speak about Healthy Heart. February is American Heart Month. Heart disease is like the #1 killer in Americans. And Rebecca, can you tell us what heart disease is and like the causes?
Yeah, so great question. Heart disease, also known as cardiovascular disease, it's kind of an umbrella term, meaning that it describes a wide range of different conditions affecting our heart. It can include, blood vessel disease, such as like coronary artery disease, heart rhythm problems, some heart defects that some people are just born with, other heart valve diseases, diseases of the heart muscle itself, and sometimes even infections of the heart. So the causes, hard to say, it just kind of depends on the actual specific condition that we're talking about. But like I said, it can be due to just being born with a defect in your heart, a congenital defect. Sometimes we get infections in our body, and the infection can go to our heart, causing heart disease. It could be lifestyle related. If we, live a poor lifestyle with poor healthy dietary habits, we are not getting the recommended physical activity that, on a daily basis or a routine basis. That can build up fatty plaques in our arteries, which cause damage, cause issues. Other causes could be, drugs, excessive alcohol or caffeine intake, high blood pressure, smoking, and even some medications, both over-the-counter and prescribed or supplements, can cause some heart disease.
Okay. And so who would you say is at risk for heart disease?
Yeah, good question. So some individuals are at more risk than others, and it can be related to family, like genetics. So if you have a first-degree family relative, like a parent or a sibling, biological, that has heart disease or a serious heart condition, that could put you at greater risk for heart disease. Otherwise, like I said before, sometimes it can just be lifestyle related. So if we don't live an active lifestyle, if we're not, eating our recommended fruits and vegetables, if we smoke a lot, those risk factors can, put us at higher risk for heart disease. Even just like being overweight, as a lifestyle.
So what are some warning signs or symptoms?
Yeah, so kind of like the causes of heart disease, it can be tough because there are several different conditions that cause heart disease. Sometimes you can have very few symptoms or no symptoms at all. And then sometimes, people have very vague symptoms, like they feel tired or fatigued. They have, a little bit of shortness of breath. Sometimes they can have swelling to their feet or ankles, even, with a little cough that is just kind of persistent, hangs around. Those can all be some signs of heart disease that should be evaluated. Some more serious signs that we would recommend getting, emergent care for, or emergent evaluation for, would be chest pain, jaw, neck, arm, or shoulder pain, shortness of breath, and or fainting. Those we would recommend to get evaluated emergently. Those could all be signs of serious heart disease.
So, do men and women experience like the same symptoms?
So they can. However, sometimes women present with what we call atypical symptoms, or symptoms that just really don't make sense. They're not typical symptoms that we see when people present with heart disease. So sometimes women, and this is why they tend to present to emergency rooms or doctors, hours after what men would present, they might feel more like of the tiredness and upset stomach, maybe some nausea, vomiting, cold sweats, those sorts of symptoms. So women, it can be a little bit more challenging. However, sometimes they can experience the same symptoms like men.
So can heart disease be cured?
Good question. So heart disease cannot exactly be cured or fully reversed. However, with the proper evaluation and proper treatment, in a timely manner, we can help better control symptoms and manage the disease from progressing.
So what can we do to help prevent heart disease?
So several different recommendations I would have to prevent heart disease. Number one would be to avoid smoking if you don't smoke already, or if you do smoke, quit smoking. Talk with someone, family, friends, a support group, or even your primary provider, and get the help that you need to stop smoking. Smoking is the leading avoidable cause of premature death when it comes to heart disease worldwide. So, when someone stops smoking, the benefits of quitting can be seen as few as, a couple of months after you quit. So it's never too late to quit when it comes to cardiac disease. Number two, I would say, make sure that you have good control of all your other, chronic diseases. So if you have high blood pressure or high cholesterol or, even diabetes, just make sure that you're working with your provider to, best control that as best as possible, whether that's taking medications or, really working on your lifestyle. Number three, I would say, really focus on physical activity, routine physical activity. Recommendations are 150 minutes a week of moderate intensity activity. So, and that looks different for everyone. So I just usually recommend anything that gets our heart rate going for 30 minutes. So whether it's a brisk walk, outside, we go to the grocery store, we walk around the grocery store a couple laps, pushing a cart, or going and walking on a treadmill. Like I said, it looks different for everyone. So just try to be as physically active as possible. And then just making sure that, we're living a healthy lifestyle. So we're really getting our recommended fruits and vegetables. Low sodium is really big when it comes to heart disease. So really watching our salt intake and the processed foods. And then other recommendations would just be, really watching our alcohol intake, avoiding drugs, and then making sure that, we're taking our medications like they're prescribed and like like you're told with your provider. So really work with your provider on that.
Okay, so how would my family history affect my heart health?
So when it comes to family history, like I said before, if we really like to focus on our first degree relatives, our biological parents or biological siblings. If any of them have a serious heart condition that's kind of premature, we like to say a serious cardiac event before the age of 55, then that can put us at risk for increased cardiac disease. So, really knowing your family history is great, especially when you're coming to your, primary care provider at an appointment, and just being able to, reliably let your provider know of your family history will help.
Oh, okay. Thank you.
Yeah.
So, thank you, Rebecca. I just want to say take an active role in reducing the risk of your heart disease by eating healthy, engaging in physical activities, managing your cholesterol and blood pressure. And this is a great chance to start a healthy heart lifestyle. So thank you, Rebecca, and then thank you for joining us. Join us February 22nd when Laura Langley will be discussing diabetic foot care with us.
Thank you.